Nigeria's Center for Disease Control has detected a confirmed case of the SARS-CoV-2 Delta variant, also known as lineage B16172. The variant was detected in a traveler to Nigeria following the routine travel test required of all international travelers and genomic sequencing at the NCDC National Reference Laboratory, Abuja. The NCDC says measures put up by the Presidential Steering Committee, like the introduction of travel restrictions from countries where there is a surge in cases associated with widespread prevalence of variants of concern, compulsory 7-day self-isolation and repeat tests on the 7th day after arrival, are still in place to reduce the risk of spread of the virus. Director of Prevention Programs and Knowledge Management, NCDC, Dr. Chinwe Ochu, joins us live via Skype for more on the Delta variant detected in Nigeria. Good to have you join us, Dr. Ochu.
Thank you for having me.
So talk to us about how deadly this variant is when you compare it to the others, and then if this could trigger a third wave in the country.
Well, the Delta virus is a virus that is known to have affected up to 90 countries in the world and is known for its high transmissibility. And also, there is still a lot that we are trying to learn about the virus. And we've seen the terrible consequences in countries that have been affected by this virus. So our goal has been to ensure that we, as much as possible, prevent importation of this virus into the country. And if it eventually comes in, that we detect it early enough to respond. There are still a lot of ambiguities around the virus, and evolving knowledge shows that this is not what we want to have in our country currently. So the restrictions that we have put in place, especially strengthening surveillance at the points of entry, so that those that are traveling into the country or out of the country, so to say, are usually tested routinely, screened for the COVID-19 virus. And where someone tests positive, especially someone coming in from another country, we prioritize genomic sequencing for such people. So it was through this process of screening travelers that we were able to detect this case of SARS-CoV-2, the Delta virus in the country.
All right, so I was asking if this could trigger a third wave in the country. We understand that we're managing it now, but does it have the capacity to then trigger a third wave?
It does have a capacity to trigger a third wave because we've seen that happen in other countries, and we don't want to have that experience in the country. And that is why we keep prioritizing the compliance to all these non-pharmaceutical interventions by Nigerians. You know, the tendency for people to lower their guards because they feel the numbers of cases are dropping is there. And as the National Public Health Institute of the country, we've tried as much as possible to be transparent and to provide relevant information to Nigerians to help every Nigerian to stay safe. So it is still very, very important that we adhere to these preventive measures of wearing our face masks in public places, washing our hands frequently with soap and water. It is these preventive measures that can prevent a third wave of the virus, because even if that strain is in the country and everybody is complying, the risk of spread of that variant will be very minimal, and we can prevent a third wave. But where everybody relaxes and begins to indulge in risky behaviors, then the chances that these variants could spread in the country will be very high. And that is why we keep advocating that everybody should take responsibility in maintaining the gains so far that we have gotten in our response to the pandemic, so that we stay safe and remain safe as a country.
Right. So we understand that the vaccination program is still ongoing in the country, but some people have taken both doses of the vaccine. So what are their chances against this virus if they have been fully inoculated?
Our target is actually to vaccinate as many people as possible in the country, because if we don't achieve that coverage that can give us herd immunity, then no one can really be said to be 100% safe. Yes, someone who has been vaccinated, the chances of the virus causing a disease in that person will be very minimal. But until we achieve that herd immunity, whereby we're able to cover up to 60 or higher percentage of the population with 2 doses of the vaccine, nobody can really relax and say, I am safe. So this is why we are doing our best. The Presidential Steering Committee, along with Nigeria Center for Disease Control, the National Primary Healthcare Development Agency, and all our relevant partners are working to ensure that we have as much of these vaccines available as possible, and that we cover as many of Nigerians as we can to achieve that herd immunity.
And we hope that people will follow your advice and begin to mask up and follow all non-pharmaceutical guidelines. Director of Prevention Programs and Knowledge Management, NCDC, Dr. Chinwe Ochu, thanks for talking to us.
Thank you very much.